Good afternoon. My name is Elisha Rhodes, and I am the Interim CEO and COO of the Ywca USA. Thank you for joining us for the second installation of our From Reckoning to Resolution series. From Reckoning to Resolution is a series designed to feature fearless movers, innovative shakers, rainmakers, and passionate trailblazers who are working to organize, disrupt, and destroy the many barriers around issues like racial justice, gender equity, pay equity, domestic violence, entrepreneurship, and so many other issues that continue to plague communities of color. At YWCA, we serve as the catalyst in the racial equity movement and to support women of color through a variety of program resources and services for over 163 years. The work is focused around awakening individuals and communities, as well as helping them to develop the awareness, willingness, and tools to drive change in themselves and institutions. And we share our work today with each and every single one of you joining us. So thank you so much for being here with us. Today, this is our second installation. We had the opportunity in our first installation to sit with Dr. Ibram Kendi, who walked us through what it means to be an anti-racist. Not only from an institutional level, at YWCA, we are always evolving to figure out how best we can show up for the communities we serve, how best we can show up for our colleagues, how best we can embody our mission to eliminate racism and empower women. So it was really important for us to have Dr. Kendi sit with us and talk about what it means to be an anti-racist organization. But even more important in this moment in time, it was also really important that we share and we work together as a community at large to figure out what does it mean to embody the practices of anti-racism within our daily lives, even outside of the workplace, outside of when we're servicing people within the community, when we're just interacting with family members, when we're at the grocery store. What does it mean to care for our community members in a way that we build equity so that we all can thrive? So if you have not checked out our first installation of our From Reckoning to Resolution series, please do so. It is on YouTube, and you will enjoy and you will learn, and I hope that you will participate in this growth opportunity. We're not here to only talk about the things that are paining us and stopping us from growing. We're also here to talk about the resolutions that we all need to move forward and build the communities that we need so that we can all thrive together. Today, some of us our kids are already back in school, depending on where you are in the country. And some of us are getting ready to send our kids back in school. Some of us are getting ready to re-enter the workforce. Some of us are trying to figure out, do we want to re-enter the workforce? Some of us have never had that option. And I am so honored to sit today with someone that has been a trusted member of the medical community for many, many, many decades. Someone that has also become a trusted member of so many of our households. We've seen her on CNN. We've read her articles in the Washington Post. Dr. Leana Wen has been someone that so many of us have leaned on throughout this COVID pandemic. And as the Delta variant continues to plague our communities and put us back into this space of unknown, when we thought that we had kind of figured out where we were going and we kind of started seeing an end to this awful pandemic, Dr. Leana Wen continues to help us figure out what are some of the options that we have as a community, as our families, as we try to protect ourselves to get through this pandemic. Additionally, I am so excited to share that Dr. Wen has also authored a book called Lifelines, A Doctor's Journey in the Fight for Public Health. Today, we are going to get into her work. We're going to talk about some of the things that she learned when she led the Baltimore Health Department as the commissioner. We're going to get into some of the things that she is going to share with us just as she journeyed from an immigrant child to where she is today. I'm so happy to share space with Dr. Leana Wen. I'm so happy that she's also a trusted partner of YWCA. She joined us in our Stand Against Racism campaign, where she moderated our town hall event. She was also the recipient of our Public Health Excellence Award at our Racial Justice Summit Gala. Dr. Leana Wen is someone that we trust at YWCA USA. She is someone that we lean on as we also take on the fight and recognize that racism truly is a public health issue, not only because of COVID, but it always has been. And we're here to make sure that it no longer is. Dr. Leana Wen, thank you for joining. Good afternoon, Dr. Wen. Thank you so much for joining us today. It is an absolute pleasure to have you here with us. How are you doing, Dr. Wen?
I'm doing very well, Elisha. Thank you so much for inviting me to be part of this conversation. I so admire the work that you do, that the YWCA does, and am really honored to once again be in conversation with you. So thank you.
You are certainly welcome, Dr. Wen, and thank you so much for continuing your partnership with YWCA and supporting the women in communities that need us the most. And congratulations again on the book Lifeline, The Doctor's Journey in the Fight for Public Health. If you don't mind, can you start by sharing what compelled you to write the book?
Yeah, I wrote Lifelines, and I so appreciate your asking about this. I wrote Lifelines mainly initially to tell the story of public health and the work that we did in Baltimore. There is a saying that public health saved your life today, you just don't know it. And that's because so often the work of public health is invisible. You don't see the work that we do because it's all about prevention. And so there is not the face of success in public health because we have prevented a terrible outcome. I mean, there is a face of a child who was lead poisoned, but what about the face of a child who could have been lead poisoned if not for the home remediation that we did? Or what is the face of someone who didn't die from an overdose, but could have died if not for the addiction treatment that they were given? And so I think that's what makes the job of public health so important, but so challenging at the same time. And I started writing Lifelines to talk about the work that we did in Baltimore when I was the health commissioner. For example, the work that we did in reducing infant mortality in our city by 38% in 7 years. By the way, we also cut the disparity between Black and white infant mortality in our city by over 50% in that same time period. Or the work that we did around providing glasses for children in Baltimore, or in making naloxone, the opioid antidote, available so that everyday residents saved the lives of over 3,000 fellow Baltimoreans in a 3-year period.
Oh, wow, Dr. Wen, reducing the infant mortality rate by 38% in 7 years. That is some amazing work that you and your team did while you led the Baltimore Health Department. Can you share a little bit about what led you to go from ER work to running the Baltimore Health Department? That seems to be like a big shift. What led you to that shift, Dr. Wen?
Well, my dream was always to become a doctor, and I really wanted to become an emergency physician because these were the days before the Affordable Care Act when, going through my medical training, I frequently saw patients who were priced out of the ability to pay for their healthcare and suffered as a result. I wrote in Lifelines, for example, about a young patient I had who was essentially in a coma because he had a prolonged seizure. He had epilepsy and could not afford his health insurance and therefore could not afford his seizure medications. And that's why he ended up, his wife ended up having to withdraw life support because he wasn't going to be waking up, and they left behind young children. I mean, that didn't have to happen. And I felt very strongly about becoming an ER doctor so that I never had to turn away any patients because of ability to pay, because of their health insurance status or lack thereof, their immigration status, who they are, etc. It was also the working in the ER that I saw the failures in our health system. that unfortunately there are it's not just the medicine that our patients need. I mean, in this case, advocating for health insurance was also important. Or I remember another patient I saw who was a young boy who had asthma. Now, what was triggering his asthma every time was it's not that he needed a better inhaler or steroids. What was happening every time was that he and his mother were experiencing homelessness. They were going between different shelters and relatives' homes where people around them smoked. And at some point, they lived across the street from an incinerator. It's all these other factors that are important for health, the air that we breathe, the food that we have access to. In Baltimore, 1 in 3 African Americans live in a food desert compared to 1 in 12 whites. I mean, there are systemic inequities that have led us to where we are. We need to address these issues, but there are also tangible steps that we can take in people's lives right now. And I was drawn to public health for that reason, because there is the sense of we need to tackle these fundamental injustices and structural racism and these problems that have been in our system for so long. But there are things that we can also do short term that also make a difference in people's lives right now.
Thank you so much for sharing that, Dr. Wen. During the book and so many times throughout your career, you have raised the issue that racial equity plays a role in access to medical resources, and that it truly does play a part in public health. I'm wondering, as you led the Baltimore Public Health Department as the commissioner, you had to deal with the civil unrest in the city around the Freddie Gray death. You also had to deal with the opioid crisis and so many other issues in the Baltimore City community. I'm wondering if you can share how you dealt with those issues while still centering public health, and also what are some of the programs that you are most proud of, in addition to the things that you mentioned earlier around infant mortality.
Of course, thank you for asking this, and of course, I'm very proud of the team that did so much incredible work in Baltimore. My predecessors, Peter Bielenson, Josh Sharfstein, among others, were incredible leaders. My successor, Letitia Jiraza, also fantastic, and we were very fortunate to have so many wonderful partners in Baltimore who also were so committed every day to not only improving health but also reducing disparities. I mentioned earlier our Be More for Healthy Babies program, instrumental in reducing infant mortality, that had over 150 public and private partners, from religious organizations, nonprofits, neighborhood associations, to our hospitals, insurers, and businesses. Then I talked about the program we had, Vision for Baltimore, that involved getting glasses to every child. Now, glasses is not the only intervention necessary in order to improve educational outcomes. But I don't think we need another study to tell us that if kids can't see, they can't read. And there was previously a study done that found that up to 10,000 of Baltimore school children between grades K through 8 needed glasses, but were not able to get them. And so we were able to start a program to get glasses for every child who needs them in every grade K through 8, right in their school, without the child having to miss class, without parents having to miss work. That I also think is another important illustration of doing something right now. And then I'll also mention the work that we did around food access as well. One of the leading killer of Baltimoreans and Americans is heart disease. And we know that food access is a major problem. I mean, I always felt quite hypocritical, actually, in my work if I am treating a patient who has diabetes or heart disease. And here I am telling this patient that they need to eat healthier foods. But if they tell me that they live in a place where they don't have access to healthy fruits and vegetables, that they have to take 2 buses and then walk 10 blocks, and then by then they reach a Whole Foods and can't afford that food. I mean, what are we doing at the end of the day if our interventions are things that are literally inaccessible to our patients? So we had a program still going strong now, where we partnered with ShopRite, a local grocer, to deliver food to senior centers and libraries in places of otherwise lack of where people otherwise lack the ability to get fresh produce, and that way they could place orders every week and get their groceries that are delivered to them in their communities. And we partnered with corner stores to help them with refrigeration, so that they could also form partnerships with local farmers markets, and then they can offer fresh produce that way as well. I mean, that's an example of how longer term, the issue that we have to address is cardiovascular disease. And getting food access now may not be making a huge dent in that sense, except we are providing services to people right where they are that's making a difference in their lives. And I think so much of public health has to be very practical. It's got to be looking at the long-term trajectory of where we want to go, but also addressing the short-term health outcomes that make a difference too.
I love that, Dr. Wen. I think that that is something that just absolutely resonates with me, that we just need to meet communities where they are. And it is just so meaningful. And to hear you say that and articulate that, it just gives me goosebumps. I think so many times we as service providers, whether in the medical arena or any service providers, we create programs or services and we just push them to communities instead of meeting communities where they are, creating partnerships with community members and trying to figure out where are you, what is it that you need, and how best can we work together to meet your needs. So I want to thank you for just lifting that up. Thank you for always, always, always putting community needs at first. And thank you for always partnering with communities, hearing them and treating them as partners. I think that that is what stands out in your work is just meeting communities where they are to make sure that they're actually getting the access to the things and the resources that they need so that they can thrive. In Lifelines, you talk about your journey as an immigrant, as a Chinese American, and how it influenced your work in public health. You also spoke about your journey as a mother. How does motherhood continue to influence your work in public health, Dr. Wen?
Yeah, actually, something that I had not intended to write so much about in Lifelines, but ended up being a through line throughout the entire book was motherhood. Part of why it became that way was I wrote the book when I was pregnant with my daughter, who is now 16 months old. And so I think I was thinking a lot about motherhood just as a result of being pregnant whilst writing this book. But another part was I reflected a lot about my relationship with my mother. Again, something that I hadn't come into this thinking, oh, I'm going to write about my relationship with my mother, but it became that way. I think also because I was reflecting a lot on my being a new mom. And there were a lot of painful parts of my upbringing and my relationship with my mother that I ended up writing about. For example, my mother was gone for so much of my childhood because she was working multiple jobs. We came to the US with $40 just before I turned 8, and my parents were both away. My mother was trying to get her degree to be a teacher. She ended up being a second grade teacher in Los Angeles, but she was also working in a video store and cleaning hotel rooms. My father was washing dishes in a restaurant and delivering newspapers. They were just not there, but it wasn't because they didn't care about me. It was because they were working the entire time trying to help us make our way in as a family. But I think as a result, I never really became very close with my mother and didn't become close with her until after she was diagnosed with metastatic breast cancer. And I was her caregiver for 8 years before she passed away. So I reflected a lot about that relationship, and then I now have 2 children, an almost 4-year-old and the baby who's now 1. Your question was about how being a mother changed my views on things. I mean, I think it changed me completely in a way that I probably wouldn't have previously acknowledged or previously recognized. I mean, from something as basic as before, as a manager, I never really thought about what would happen if I scheduled a last-minute meeting at 4:30 in the afternoon. or if I asked for a conference call at 8 a.m., or other times that would have been really inconvenient for parents with daycare drop-offs and school times and after school and everything else. I mean, I just wasn't conscious of the things that I was asking of the people that I worked with. That's kind of on the everyday mundane side, if you will. Then on the policy side, I mean, one of the most challenging things in my role as the health commissioner in Baltimore was chairing the child fatality review committee, where we looked at every case of children who died in Baltimore, teens who were shot, or babies who died from sleep-related causes, or young children who were abused and neglected. I mean, terrible, tragic cases. It became even harder once I became a mother because I just imagined the grief of that family. And then I also looked at everyone differently, of all the people that we serve differently, and thought about the grief and the trauma that it was causing their entire families. Not that I was unaware of this before, but I think I just experienced this in a different way as a mother thinking about my own children. And I go into a lot more depth about this in Lifelines, because it ended up becoming, in a way, an ode and celebration of motherhood, of caregiving, of parenthood in a way that I would not have anticipated earlier.
Dr. Wen, I want to thank you for sharing that. Thank you for sharing a piece of you with us. Thank you for sharing a piece of your family and your journey with us. Thank you so much for that. You joined us back in April for our Stand Against Racism town hall, and we were so grateful that you were able to join us as a moderator and that we had your voice and that we had your support as we nationally declared racism as a public health crisis. Since then, the CDC has also declared racism a public health crisis. And I'm hopeful that this issue will get the attention that it needs to actually make the necessary changes in marginalized communities, which are the communities that are impacted the most. We talk a lot about the impact of COVID. We talk about how COVID continues to expose the disparities that existed in the communities of color for many, many years. And because of COVID, those disparities continue to increase. We talk about the lack of access to healthcare. We talk about how COVID continues to expose that. And we talk about how COVID also has stressed the healthcare system and how the lack of healthcare that had already existed has now become a life or death problem for so many Black and Brown people. We talk about the mortality rate in the Black and Latinx communities because of COVID. And we talk about the frontline workers they did not have the choice to stay home and work from home, work remotely during the pandemic and even now. They did not have the choice. We talk about the kids that are behind in school and didn't have the resources and the proper support. And we talk about the limited food access because of COVID. What is it that you are hoping that we learned as a community, as a country, during this pandemic that continues to go on, and we continue to be set back? And we are grateful for the things that the White House and our leaders are doing. There's a child tax credit that we're hopeful is extended. There is the mortgage and the eviction moratoriums. There's the student loans moratoriums there are things that we hope are extended, but those are temporary fixes. And we are in the business of permanent solutions that will move our communities from surviving to thriving. And those temporary fixes are still temporary fixes that people can still sit at their tables if they have tables. Think about, okay, if we get this temporary fix, this is how we're going to survive from this month to next month. But what is it that we need to do, in your opinion, to get us from how do we survive from today to tomorrow, from next month, from this month to next month, to how do we create environments where students can dream, parents can dream, they can support their kids, and we can thrive as a community of color. What are the recommendations that you can put forth, or what is some of the things that you hope that we've learned as a country with this pandemic?
Yeah. I mean, and this is one area where, again, I so appreciate your continued leadership and YWCA's presence here. We were part of this conversation you mentioned about COVID and disparities. I was really honored to moderate a conversation with other leaders who are on the front lines, working in this and amongst so many people around the country and the world. I mean, COVID, we know, did not create health disparities. That when we saw unequal outcomes for Black Americans, Native Americans, Latino Americans, that it's not that this virus is somehow targeting certain people and not others. It's that actually that we have systems that have always been unequal, and those disparities are manifest in different ways, including that essential workers tend to be people of color. Low-income individuals might live in areas where they don't have the ability to physical distance, and therefore everybody in the family ends up getting infected when one person becomes infected, and so forth. And I think that there is an opportunity as we are learning from COVID and learning from where we are, that we do not let these lessons be forgotten once again. And that we also have seen, I think, during COVID, that unless we are intentional about addressing health disparities, they only worsen. For example, we saw then with the vaccination rollout that, again, people of privilege who tend to be individuals who are white and with higher incomes, that these are individuals who have access to vaccines first. And that unless we are specifically addressing barriers to access, then individuals who are more disadvantaged and more vulnerable are going to continue or those disparities are going to be exacerbated in these communities. And so I think we have a real opportunity to be intentional about health equity, and we have a real opportunity to also really address public health as in the way that it needs to be.
Yes, absolutely, Dr. Wen. And like you said, COVID does not discriminate. Absolutely. And unfortunately, you yourself and your family had your own personal experience with COVID. Do you mind sharing with our audience what that unfortunate experience was?
Yeah, I mean, I think this is one of those chapters that I never thought that I would end up writing. And actually, I'd written the book, just to explain too, I'd written Lifelines prior to COVID. It was actually delivered to my publisher in February of 2020. So not exactly pre-COVID, but prior to our world seeing the impact of COVID as we clearly have since then. And so my publisher said, you have to write about COVID because this is the biggest public health crisis of our time. Who writes a book about public health without addressing COVID? And so I ended up rewriting significant portions of the book, but then specifically adding a book at the end that I never thought that I would write, which is called COVID Comes Home. And so part of it, I wrote about my experience in April of 2020, giving birth in the time of COVID. Again, not something that one exactly plans on doing. And about the fear that was there. I mean, I'm a physician, but I still I had so many fears and concerns about my childbirth. I didn't know whether my husband was going to be able to be in the delivery room with me. I had all these fears about what if I test positive for COVID and can't hold my newborn, then because we don't have the amount of travel that we could have had safely prior to the pandemic. I think for so many new moms, this became a pretty isolating experience where our family were not able to come and visit the baby. So I ended up writing about that experience. But then also prior to the vaccines becoming available, my husband ended up contracting COVID. And my two little kids started having symptoms as well. And I wrote about that experience in the book, about what it was like to become a caregiver. Again, not something that any of us plan on doing, but end up being so many people's realities. And I think right now, it's so tragic to reflect on the times that we've been through, that we're talking about, what, 615,000, more than that, of Americans who have died since the beginning of the pandemic. We have hundreds of children who have died. And it's extremely, it's so frustrating also to reflect on this, because even now, there are still these debates that are ongoing about basic public health measures like vaccines and masks, and it's so concerning, so frustrating, and really, I think it emphasizes the importance of public health in all of our lives.
I'm so happy that you and your family are all doing well. And it is, as you always say, a personal decision that we all have to make on how we deal with COVID, as long as we make the decision based on facts that are laid out by scientists, by doctors, and by experts in the field. So I have an 11-year-old. He's entering the sixth grade. He is going to a new school. I am really, really nervous. I'm sending him back to in-person school. And I'm wondering, and you also have, you're a mom, as we know, when you're getting ready to send your kid back to school. And I know so many of us and so many parents across the country are nervous about sending their kids back to school. What advice do you have for us as parents and caretakers as to what we should be doing and how we should be preparing to send our kids back to school to keep them safe and to keep us safe as they return back into the house after a full day of school, Dr. Wen?
Yeah, I just wrote a column about this in the Washington Post. And I think that there is, as with all the elements that I'm talking about, there is a societal responsibility, as in we should be doing better in our schools, as in schools should be following CDC guidelines. We shouldn't be having arguments about whether to mask in schools. Everybody who's able to be vaccinated should be so. That's not really the reality of the world that we're living in, and that's why I write a lot and do commentary for CNN also on what are the practical things that we can do, even as we recognize that it's not ideal, as that we shouldn't be in this position. But given that we are in this position, what can we still be doing in order to protect our loved ones? And so, for example, I talked about how outdoors remains a much better place than being indoors for people who are unvaccinated, including children. And so trying to encourage kids to have play dates and sports and everything else outdoors, to also save masking for indoors. I think it's really hard to tell kids to be masked all day and after school, when playing with their friends and in school. I mean, it's hard. Instead, I think if we focus on saying, anytime you're indoors, wear a mask. If you go outdoors, you can take off your mask. I think that focuses people's attention much more to what those settings are that are the highest risk. Something else is making sure that all adults and people over 12 and older who are able to be vaccinated are vaccinated. That also ends up protecting the children as well. And then another thing, I know that there are a lot of schools opening that may not be requiring masks. Parents should still try to contact the other parents in the class to see if the other parents would voluntarily agree with their child wearing a mask, because maybe you can create masking as a norm in your class, even if it's not required per se. Also, remember that a mask protects the wearer as well. And so wear at least a 3-ply surgical mask. A cloth face mask is not going to be enough. And if your child is comfortable with wearing one, an N95 or a KN95 is going to be important too. And then finally, I would just say, remember that risk is additive. And so be careful during informal activities as well. It would be a shame if kids were really careful during a soccer match or a basketball tournament, but they're letting down their guard in a locker room and are having indoor pizza parties afterwards, right? That doesn't make sense. We want to make sure that our children are back in school, understanding that there is going to be some level of risk involved, but try to reduce the risks in other aspects of your child's life.
Dr. Wen, I am in awe of all of the things that you have done in your career and all of the different hats that you've worn, and you've worn them well. And we as a community, as a public, have benefited from your skill, your commitment to our health, to our wellness and to our safety. I'm wondering if you can share, in your experience, how can public health institutions and social issue nonprofits like YWCA partner together to take action on public health issues?
Um, I think that it is really important for us to use one of the phrases, one of the core tenets of public health, if you will, which is to meet people where they are. As in, we need to recognize, those of us in public health need to recognize that not everyone cares instinctively about public health. We have to make the case for them, as in, we have to be the ones who make the case for how, if what you care about is education, well, if our kids are unhealthy, if they're hungry, if they have unaddressed mental health and trauma, they're not able to focus in school. We have to be the ones to make that case. Or if what you care about is public safety, well, it doesn't work to address mental health and homelessness and addiction as criminal justice issues. We need to be addressing these as health issues and getting people the treatment and the housing and resources that they need. If you care about the economy, well, I hope you care about COVID and what it's doing to our economy, but also recognize that a healthy workforce is important to economic recovery as well. So we need to make the case for people as individuals in public health. And at the same time, I hope we'll also do a better job of enlisting everyone as members of the public health workforce. We have seen during the coronavirus pandemic how the work of every individual makes a difference, that we are on the front lines of the pandemic in different ways. And I hope we will all embrace that difference too.
Absolutely, Dr. Wen. I guess my final question today, as we think about racial justice and gender equity, and the women that we serve across the country in the 45 plus states, including the District of Columbia as a network. What is it that we need to do on a local and national level to appropriately fund services so that women can receive comprehensive public health resources at all times without a doubt?
Yeah, I really appreciate that question because I think for so long we have not understood women's healthcare to be healthcare that it really needs to be. My vision for what women's health should look like is, as it should be for anyone, that you should be able to go to your clinic, your health center, your local doctor, and be able to get all of your services addressed, your needs tended to at that time. As in, if you are going in for birth control, you should also be able to get your blood pressure checked, to have your diabetes be managed, to be screened for if you need mental health services, and then if you have depression or anxiety or something else, you should be able to see a therapist at that time. You should be able to see a nutritionist because food access is also really critical. Your dental health should be cared for in the same way that we see other aspects of physical health. Mental health and physical health also need to be understood hand in hand, and we really need to be treating the whole person. We know that what makes someone healthy or unhealthy is also not just about the health care that they receive, also the other conditions in people's lives, and we really need to embrace housing, for example, as a healthcare issue as well. It's that holistic sense of healthcare for everyone, whether it's women or men or children or all people. We need to be embracing that level of non-judgmental whole person care. And I think if we're able to, when we're able to reach that ideal medical care, that's when we're able to truly provide the best type of care that people need.
Thank you so much, Dr. Wen. As we close today, are there any other thoughts or parting words that you wish to share with our audience?
I think I would just add that it really is up to each of us. Sometimes the problems that we face can seem so big. And often when we talk about public health and social determinants of health, it's, well, if something is connected to something else and then everything feeds into each other, sometimes there can be a sense of decision paralysis of where do I even begin? Well, I want everyone to know that there is something that you're already doing every day that's making a difference, but also don't wait. Don't wait until you have the perfect opportunity. Don't wait until the ideal situation comes to you. Rather, do everything you can with the position that you have right now and continue to make a difference every day.
And then can you also share with our audience how they can stay connected with you and the great work that you continue to do for the communities that are so near and dear to our mission?
Wonderful. Thank you so much. And you can follow on Twitter at Dr. Leana Wen. And of course, I would very much appreciate, and Elisha, very much appreciate your support of my new book, where I talk a lot about the issues that we discussed around health, around public health and disparities, and striving for health equity in Lifelines. So thank you very much, Elisha, and also thank you to the incredible work that you and the YWCA do every day on behalf of the communities, the people that we serve.
Thank you again, Dr. Wen, for spending time with us today. It was an absolute pleasure being in community with you as we learn from you, as we learn what we can do better as a community, as an organization, as a people, as we drive to change. I want to thank you for standing with and for the communities that need us the most. Thank you for continuing to partner with the YWCA. I truly look forward to continuing that partnership as we continue to declare racism as a public health crisis. I also very much look forward to getting your book, Lifelines, into the hands of so many of our local associations. Thank you for your time, and I hope that you enjoy the remainder of your day.
Thank you. You too.
Public health is and has always been central to the work of racial justice. This year, our team is especially pertinent as our country continues to face the intersecting public health crisis of COVID-19 and racism. What we have said earlier and what we continue to say is that COVID has created situations where it is exposing the disparities of the public health inequities within our communities. It is exposing them, it has not created them. What we know is that these inequities existed far long before COVID came. Our job is to understand the economic and social determinants of health and how racism impacts public health outcomes. It is critical to uprooting the systemic inequities in communities of color. Understanding the impact is only the beginning and it's only part of our work. We understand and then we seek solutions. We reckon and then we seek solutions. And that is what we're here to do. We're not only here to talk about the issues, but we're here to seek solutions, not individual solutions, but solutions as a community, because our communities depend on us. Just like we talk about how COVID isn't going anywhere, solutions aren't going to seek themselves. So I want to encourage each and every single one of you to continue to have these conversations, even when this series is over. Have these conversations in your communities. Have these conversations at your dinner table. Join these conversations. Join us on our website. Seek more resources within your communities. Log on to ywca.org, where you will find a wealth of materials that you can use to have these conversations and to seek the solutions that we desperately need for the women and girls and their families to move from survival to thriving. Thank you for joining us today, and we look forward to hosting you at our next From Reckoning to Resolution series. Do have a great day.